Hi, I'm Dr. Winslow for Asian Parents, and I work at the Winslow Clinic at Novena Medical Center. I'm here to talk to you a little bit more about attention deficit hyperactivity disorder. Now, this is a often misunderstood diagnosis, or it's often missed. I even had to go to a child's school once where there were 2,000 young boys in the school, and the teacher said, when I told them one of their children was attention deficit disordered, I said, oh, we don't have any other children like that. Now that would be really unusual, because the percentage of children who actually do suffer from some form of attention deficit or hyperactivity as children ranges from anything between 2 and 5%. Now, it's important to pick it up because it can have a detrimental effect on your child's studying or performances in school. In fact, children who cannot pay attention are often picked on by the teacher, sometimes ridiculed by their classmates, and get into a fair amount of trouble. In fact, some people say that they are outstanding, standing outside the door, that is, or sent to the principal's office. What can be done about this? Well, the first condition is to make sure that you know what we are talking about, and anybody who comes in for an assessment for ADHD gets to do pencil and paper tests and have a clinical interview with a psychologist, after which there are standardized ways of assessing what are the key areas which are being affected, whether it is the inattentiveness or the hyperactivity or a combination of both. Now, what happens after that is we come out with a treatment plan for the parents and the child, obviously. And we have to take into consideration quite a number of things that are taking place. For example, how bad is it? Can it be controlled purely with psychological means, or do you need to also use some medications? And what are the benefits and what are the downsides of medications? And so, in a collaboration with the parents, we usually make a choice, and the outcomes have been really quite remarkable. Just last week I had a young girl sitting for her PSLE this year, whose parents were kind of overjoyed because without too much difficulty she moved from 60-70% to 80-90%, and the parents and the teachers were amazed. So it's just the small changes and small things that you can do both in the psychological realm as well as with medication which can make a difference. Thank you. I'm Dr. Winslow.